Welcome, everybody. This is November 30th, 2023. This is being recorded for those that could not make it in. I am Daniel Benning. There's a lot of new names, and I really greatly appreciate the interest. This is Daniel's Downloads for those of you that are new to it. And I've been doing this now for almost 2 years. And these are 35-minute sessions. So those that will be listening to the recording, you'll know how long it is. Today, we're going to cover SIBO and post-SIBO. Now, in the past several talks, we've talked about SIBO a little bit, but we're going to get a little bit more in detail. Biotics Research has had 3 great speakers, great webinars over the past couple months on SIBO. And they've gotten really deep into the weeds. And you know how I like to do it. I give you the what-fors. We'll show you some great protocols, but we are going to show you some really amazing studies that Dr. Arland Hill, one of our technical doctors in Texas, a brilliant man, has shared some slides with me that he's allowed to share with you. So stick around for all the info, because in the beginning, we're going to cover SIBO. Then we're going to go into post-SIBO and the importance of that so we don't get reoccurring SIBO. And then I'll have a special offer, and as always, the raffle at the end that those of you know, you get into the chat box and you win a product sample prize. I will not be checking the chat box during this lecture until at the end, and Jacqueline will be taking notes for me. So I always have to say, statements made in this presentation are not meant to treat, cure, diagnose a disease. These are purely nutritional recommendations. So last time, let's just one slide on last time, the hormone connection. We talked about libido, the lovers, the dreamers, and me. If any of you remember Kermit the Frog in this song, this is what stuck in my head ever since. But all I'm going to say is, with all the wonderful new names listening in, if you did not get to listen to that presentation or you'd like that presentation, email me, text me, and I will send you the link. It was a really fun topic. A lot of people had a lot of interest about how to make hormones work better, how to work with parasympathetic tone we've talked about just about in every lecture, and which enhances libido function. So if you didn't get that or you'd like it, please message me. You'll see my info at the end of this presentation. So SIBO and SIFO, I want to tie it a little bit together. We're all familiar with, or many of us are familiar with, small intestinal bacterial overgrowth. But let's also talk about fungal overgrowth, because it kind of is when you look at the literature and the speakers and the studies on the gut microbiome and what's happening in the small intestine now, it's a soup. It's a mixed bag of fungal bacterial issues very often. So this topic today ties into all of this. And why are we talking about it? Well, here's the information explosion. Look at 2015 through 18, and now 2019 through 22, the number of publications indexed in PubMed on this topic: Epidemiology of Small Intestinal Bacterial Overgrowth, the World Journal of Gastroenterology, 2023, right here. The information's off the chart. And it was interesting, a couple of years ago it was a big topic, and it kind of got a little quiet, and now it's big again in the speaking community. And you'll see the increase in studies here being published, because a lot of factors of why SIBO is such an issue. And I'm going to give you those factors. But let's talk about what is SIBO in a nutshell. For those of us that are not overly familiar, it's defined as the presence of abnormal number of bacteria in the small intestine. And again, we're going to get into the reasons why that's happening. But the exact prevalence among healthy people is unknown. However, it's estimated at 22%. 1 in 5 of your patients has something going on in the small intestine that is creating a lot of discomfort for them. So think of that. And we're going to get into these studies on the testing parameters and why not always to follow that. We need to follow being a good clinician, looking at subjective indications, using our healing intuitiveness to really put them on a solid program. So causes of SIBO, we've discussed this a little bit in past lectures, but medications, we've talked about proton pump inhibitors, antibiotics, opioids. They are just diminishing hydrochloric acid production. and I could say in a nutshell, it's the moral of the story, is hydrochloric acid production. Suboptimal motility in the GI tract, so we are not having a good transit time. We're backing people up. You know, when you ask your patient, you know, do you have a regular bowel movement? They go, yes, one every 4 days. That's not a regular bowel movement, but that's what they're accustomed to. And I see that with a lot of people. Many of the weight loss surgeries are causing issues. Poor diet. I mean, we could talk all day. I've talked to you about this. You know, the line at Starbucks at 3 o'clock for the sugar, not caffeine. And the, you know, the inside of the grocery store shopping, the box stuff. It's the typical American diet. I hate to beat that, but it's the truth. It's where a lot of people are at. And then here it is: inadequate production of stomach acid, enzymes, and bile. Again, when I came out of college and I went and worked with one of my mentors, Dr. Robertson, he said, treat the gut, you know, and this was his, I've said this before, you know, he said, if they walk in with hangnails to hemorrhoids and you don't know what to do, fix the gut. And he was absolutely right. And this is the moral of this entire story, if you ask for my opinion. We can show you all the science, but we look at this right here. So you have the perfect storm. Advanced age, so it is being seen in a more aged population. But when I say that, I'm talking, you know, 40-year-olds easily, 50-year-olds easily. Lower stomach acid, decreased motility, higher levels of medications are the perfect storm. But you don't need all of these to be having an issue. So what does SIBO look like? Well, on the left, we have clinical significant manifestations. You could have weight loss. This oily stool, why? Because it's about that bile flow. And we are not digesting and emulsifying fats, but also think of fatty soluble vitamin deficiencies, vitamin D, vitamin A, vitamin K. Okay, put that up there. Why do I have these deficiencies in the lab work? Signs of hypoalbuminemia. This is we're going to talk a little bit about the hepatic dysfunction. And then vitamin deficiencies, just like I said. If we do not have enough hydrochloric acid, north to south, if we do not have enough hydrochloric acid, we will, in a nutshell, have a harder time absorbing certain nutrients. One we talked about was the fatty soluble vitamins. So what are the symptoms? Here's the subjective indicators. And you can't tell me you haven't had maybe 9 out of 10 of your patients, if you're doing a lot of gut health stuff, come to you with some of these: abdominal pain or discomfort, bloating, feeling of fullness, diarrhea, flatulence, lots of flatulence, weakness, just overall lethargy. And again, we could also relate those to thyroid, adrenals, and all of that. But the gut, north to south, should be a primary focus. Because look, if left untreated, IBS, inflammatory bowel syndrome, these are side effects, and it's kind of in the area right now in the science of which came first, okay? Celiac disease, hepatic dysfunction we talked about, scleroderma. Look at these. We're talking about autoimmune disease. We always talk about gut health with autoimmune disease, because is it a fungus? Is it a bacteria? Is it a parasite even? Is it a food allergy that's causing this autoimmune response? Well, if we don't take care of a SIBO patient with these bacteria, and mostly abnormal bacteria that are in the small intestine wreaking havoc, we are creating a perfect storm for an autoimmune response. Parkinson's, hypothyroidism. Why is that? Remember, you have a large percent of conversion of thyroid hormone that happens in the liver and in the gut. And again, autoimmune conditions. So I've showed this slide, breakthrough study on SIBO. Gerard Mullins out of Johns Hopkins did a 4-week clinical trial over 100 patients. The herbal therapy is equivalent to rifamycin for the treatment of small intestinal bacteria overgrowth. Normal breath test after 30 days, 46% with the herbal therapy and 34% with the rifamycin. That's a pretty amazing study. So what did it look like? We had in the study FC-Cytal and dysbiocide at 2 twice a day. Here was your response, the 46% versus 34% with the antibiotics. So what did we do? We built you a kit, and you've seen this kit in the email and the marketing, that we added ADP to the kit. And so we recommend 2-3 times a day with the ADP. We are hitting this like a hammer, but I think it's needed when you look at the soup of bugs. Let me give you an example. Years ago, I was in a lecture, brilliant speakers on GI. It was actually held in Scottsdale, Arizona at the Weston, Kierland. Alex Vasquez spoke, and he talked about Klebsiella. And Klebsiella is often one of these SIBO bugs. And I want you to think about this because it's not just the gas, the bloating, and all of that. What happens with Klebsiella is the byproduct of Klebsiella, meaning its metabolites, can inhibit the P450 pathway. That's detoxification in the liver. What will that equal, is what he said in that lecture. And that will be the patient with chemical sensitivities. So if we don't get rid of that bug, and you have a patient with a lot of chemical sensitivities, you're fighting it. You can do a lot of wonderful things for chemical sensitivities, but you're fighting an upstream battle because you want to get rid of that bug so its metabolites aren't inhibiting that pathway. So we need to think outside the box of just the gas, the bloating, which are absolutely, I can't use the word diagnostic, but great subjective indicators of why to put somebody on a program like this. So here's your kit. It's a nice, patient-friendly, patient-compliant kit. It's ADP, dysbiocide, FC-Cytal. 180 tablets and capsules, so tablets on ADP, capsules on dysbiocide, capsules on FC-Cytal. You know, when you buy them normally off of our price list in the market, it's 120 as a large. We did it just for this kit at 180 to get you the 30-day supply. The beauty of this is this goes way beyond the single antibiotic therapy. And that's why it was so effective in that Gerard Mullins Johns Hopkins study. Proprietary blends of 16 botanicals with a wide range of complementary effects. And I'm going to show you where that's covering. So you have antimicrobial, you have gastroprotective, you have overall digestive support with these two products. So it's not just a single pathway. And you have the famous ADP, anti-dysbiosis product. It contains multiple antimicrobial and antifungal compounds. Remember, we talked about SIFO, fungal overgrowth. ADP is a wonderful antifungal. Okay, show directly kill and inhibit growth of intestinal microbes. It is microemulsified. So you have emulsified, sustained-released oil of oregano. Straight oil of oregano will burn the villi of the GI. Very irritating. Okay? You take a sustained release tablet of an emulsified form of oregano oil, you get a larger coverage and a better uptake for die-off. So in the kit, you have the ADP, patented formula with emulsified oil of oregano. You have the FC-Cytal, the dysbiocide, and a patient guidebook. Step-by-step guide to support patients on the program, so you're not getting so many questions. Here's the booklet. Eat clean, whole food diets, include phytonutrient foods. It explains the products and the dosing in the further pages in. So if they go home with the kit and they forget, just say, go to your guidebook. It'll help you. 30-day program. Very patient friendly. Gives you the lifestyle suggestions. Makes it easy on all of you. But again, I want you to think outside the box, and we're going to get into more details of that. Here's your pricing. And I want to know, for all of you that are new and haven't heard this before, there's a 20% off one time. So you buy one kit, 20 kits, you're getting 20% off. So $79.95 wholesale, $159.90 retail. And that ends December 31st. So if you want to try it for yourself and just see how it does, you can get 20% off with that code. So here's the mechanisms of action. You have the antimicrobial in these three products, the ADP, the dysbiocide, FC-Cyto. You have the antimicrobial, you have gastroprotective, you have anti-inflammatory, and then you have overall digestive support. So you have antispasmodic effect, decreased activation of NLRP3 inflammasomes, increased colonic concentrations of short-chain fatty acids. You've heard me talk about butyrate time and time again. So these are your short-chain fatty acids, and promote gastric acid secretion. Everything we're looking for of what SIBO causes, we are trying to fix with this program. But here's the dealio. Everybody mentions, well, I did the SIBO kit, I felt great, or I did a SIBO program, I felt great, but now I'm feeling junky again. Recurrent SIBO. We're going to shift into that area and the post-SIBO program now, because you've heard about the SIBO kit for a while. We covered the prevalence of it and the need for it. And remember the subjective indications we talked about. Because approximately 44% of patients with SIBO may experience a relapse of symptoms within 9 months of initial treatment. And approximately 30 to 40% of patients may not have resolution of SIBO symptoms with what we talk about, that single antibiotic therapy. Here's your list of different antibiotics. So this is the power slide for me. All right. Take some notes here because this one stood out for me. And thank you, Dr. Arlen Hill, for this one. Him and I have had conversations about this. The small bowel is 19 feet long. It can be colonized anywhere with SIBO bugs. When you do these tests, glucose, when administered orally, is absorbed within the first 3 to 6 feet of the small bowel. I'm going to cause a controversy here. We relying on glucose breath testing alone to make a diagnosis of SIBO will provide a low yield of about 33%. I talked to a wonderful practitioner 2 weeks ago, and she kindly said, well, Daniel, I've only had one positive patient with a test. And I asked this wonderful practitioner, but do you see patients with unresolved gas, bloating, flatulence, distension, chemical sensitivity, brain fog from these bug metabolites? You cannot go wrong, in my opinion, as a clinician, and I call myself a clinician because I'm in the game. I may not be doing what you're doing, but I get the luxury of learning from all of you and sharing ideas with all of you every day. And if these were my patients, my clients, you can do no wrong in looking at considering a SIBO program for them. For all of those avenues, the gut, north to south, fix that foundation, clear that up. We talked about autoimmune disease. We talked about so many things. That a negative glucose breath test is not confirmation of the absence of SIBO. Now, I'm an objective information kind of guy too. I love subjective information, but objective information is really important. I love a lab test, blood work or a breath test to show confirmation, because the compliance of the patient obviously goes up. But many of you are the clinic of last resort. They've been everywhere, they've done everything, they've read online what they should do, and they still come to you for help. And they haven't done a studied SIBO program like this one is. The effectiveness of this program, you saw that. You can do no harm. And then, what did we talk about earlier? The importance then of reestablishing good gut function. So antimicrobial defense mechanisms connected with the production of hydrochloric acid. If you have the right stomach acid in the stomach here, up north, where it begins with chewing of food and salivary glands. But for this conversation, hydrochloric acid. If we have enough of the proper pH, things won't survive in there. These bugs won't survive. And it's a hormonal cascade with the proper pH for the gallbladder to release its bile and for the pancreas to release its enzymes. If we have proper pH, again, bile flow and pancreatic enzyme release work much more effectively. That's why you see then pancreatic enzyme secretion as the second step. That goes down, digests the food better, gets rid of helps with the microbes. Bile flow happens. And bile has, by the way, in the literature, very strong antimicrobial effect. In fact, I read a study that people who have had their gallbladders taken out have less SIBO because they have a constant titration of bile, which we really don't want. But in a SIBO program, it's a constant titration these bugs can't survive in. And remember, we've talked about stress, poor diet. It makes that bile like sludge, and it should be like motor oil. So we're going to talk about what to do for that. And then mucosal immunity. This is when we re-inoculate with the proper probiotics to increase immunity in the gut. So here it is, hypochlorhydria. I know it sounds so simple, and I'm not trying to be simple, not recognizing all the wonderful tests and other components of this. But sometimes, as I've always done, it's back to the basics. And if we are not doing this for our patients, our clients, I feel we're doing them an injustice. If you personally tried one of our hydrochloric acid products, hydrozyme or betaine hydrochloride, you will notice feeling better digestion in itself. This is so important for this reoccurring SIBO patient. In conclusion, in this study, our results suggested low acid gastric environment as a contributing factor for duodenal dysbiosis, in a nutshell, SIBO, potentially leading to the development of pathological conditions of the gastrointestinal tract. So you put them on an amazing SIBO program. I like our kit. I'm sure you have other things you like to add to it. But our kit does cover the bases. But if we don't acidify after and don't address the GI problem after, this is what we talk about, the what's next step, the importance of the what's next step. And then treatment summary, small intestinal motility. So now we've added hydrochloric acid. Now, small intestinal motility. If things aren't moving, we talked about that problem. Vagal nerve stimulation. We have talked about the autonomic nervous system. You've heard me talk forever about L-izyme forte and things. But in a lot of the lectures I listen to, and Dr. Arland Hill talk about using 5-HTP. Again, because it's going to raise serotonin, which helps motility with all these serotonin receptor sites in the gut. So sometimes, though, the challenge here is the patient's perception. Wait, you're putting me on 5-HTP, I'm not depressed. Trust me on this one. Prokinetics, products that help with GI motility. 5-HTP is definitely a consideration. But we also have to look at these other factors. High stress, as I've talked about again and again, not to bore you with it, but the importance of it is we need to work on vagal nerve stimulation. Singing, humming, meditation, so many things increase vagal tone. But the importance of the prokinetics for intestinal motility, and this is definitely a consideration, the 5-HTP. And here's your betaine hydrochloride. So the hypochlorhydric patient of why these things are happening. And by the way, this covers the H. pylori. It covers that whole soup of bugs because this package is so broad spectrum. But the importance of adding in the gastric acid replacement. You have betaine hydrochloride and you have hydrozyme. Basically, 4 hydrozyme equals a betaine hydrochloride. And I will assure you, in most cases, they are totally fine taking betaine hydrochloride with 1 or 2 with each meal. I've been around long enough, had enough wonderful practitioners give me the feedback that this is a great way to go to get a larger, more potent hydrochloric acid capsule in. And then we talked about bile, and here's your beta plus for this program. So remember we talked about bile being antimicrobial, but we need to thin, this product will help thin the bile in the gallbladder so we get good bile flow into the GI. And I just wonderful conversation earlier this week with a doctor about, well, why don't you have a probiotic in this package? And that's what I'm going to add, and I use a probiotic. All I say to this is choose wisely. And my second statement to that is, preferably I want to kill off these bugs. It's a 30-day program. And then look at it. I'm going to show you two wonderful probiotics to consider in the research of why. Because probiotic administration in SIBO patients resulted in exacerbated bloating, flatulence, metabolic acidosis, and brain fog, with these symptoms subsiding after the probiotic preparation was discontinued. And in this medical study, antibiotic therapy was initiated because they had such an up flare of symptoms. These people can't handle many probiotics. They can't handle the high dose probiotics, the 20, 50, 100 billion. These are terribly challenged, imbalanced guts. Throwing a ton at them in the probiotic arena is causing the bloating, the flatulence, the metabolic acidosis, and the brain fog. The brain fog from hydrogen sulfide, mostly. You'll be in a brain fog forever. You got to fix the issue. The underlying issues, you've got to do a die-off and then do the proper replacement. So the effects of probiotic therapy in SIBO are strongly strain-dependent, and not all probiotics are equally effective. So look at Saccharomyces boulardii. Monotherapy with Saccharomyces boulardii was more effective than a antibiotic to eradicate SIBO. Best results in this medical study, boy, I'm missing a couple letters there in my PowerPoint, but best results noted by combining the two therapies. If it was me, I don't have the right to or have the ability to make that recommendation to do a probiotic antibiotic. Some of you do, but you have the tools in your toolbox that we've listed earlier. But again, it's the importance of looking at the proper probiotics. And many of you are familiar with Saccharomyces boulardii. It's a healthy yeast culture. It's an NF-kappa B inhibitor. It slows down a little bit of GI motility. So watch for that, because it came out in France years ago from a company used on medicated associated diarrhea. And so much has come out with Saccharomyces boulardii since then. Remember the literature curve we're talking about? The increase in amount of information, same thing with Saccharomyces boulardii. So if I was looking for a probiotic to choose from, I'd look at Saccharomyces boulardii and the BioDof3 GI. So I'm on the right side of the slide here because I want to finish that part of the story. BioDof3 GI is a low potency, 3-strain, 3 billion probiotic. Very mild and designed for that hypersensitive gut. Again, I'll tell you what, if any of you ever had an ileocecal valve adjustment by a chiropractor, because that could be a factor too of the ileocecal valve open, allowing the bacterium to head north. So find a doctor for that. It's a little painful, experienced it myself over the years. And then vagal nerve support. Again, the autonomic nervous system is so important. We are a highly stressed society right now. This is why I feel my practitioners that I get to talk to on a regular basis are seeing such GI issues, is stress, 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 and the importance of vagal nerve support so we have better motility, calmer environment, rest and digest. All right. Those are my Daniel's downloads in 30 minutes right there. And I want to offer you, and take a minute on this slide, because I want you to really try it for yourself, if nothing at all. So I'm offering 10% on any of the products we talked about today. And you can email me or text me. if you just try one for yourself. So we have Biodop 3 GI. We talked about Saccharomyces boulardii. We talked about Hydrozyme Betaine Plus. We talked about Beta Plus, 5-HTP in the SIBO kit. If you place an order with me by 5 p.m. today, I'm going to give you 10% off because I want you to experience, if nothing but for yourself, but think of this for those patients that we talked about that go way beyond just a positive breath test. Think about the importance of betaine. Think about the importance of the proper probiotics. Think about that bile flow. Gallbladder insufficiency is huge from a high-stress lifestyle, a poor food lifestyle. All right, I see some are already in the chat box. I haven't been able to look at that yet. But now I'm going to offer you the raffle question, okay? First three to answer in the chat box get a bottle of the Biodop 3 GI, that probiotic we talked about. What two products were part of the SIBO study done by Gerard Mullins? ADP and dysbiocide? You can just answer A, dysbiocide and FC Cyto, or ADP and FC Cyto. Tick tock, tick tock. And the chat box is blaring up. I'll give you the answer in just a second as Jacqueline's taking those. What I'm going to do is I'm going to take December off because it's a busy month. I'm traveling for some conferences. And I know you are all busy too. And I really greatly appreciate your time and interest. I really feel very blessed that you come to me and that you allow me to share what I learned from all of you. I'm going to do a 3-part series next January, February, March. Why biotics? Things that set us apart. Because I think sometimes we're a little humble in a good way about our story. And not that I want to say we're the be-all, end-all. And there are a lot of good products, companies out there. But I want to show you and really dig into it, some of the amazing components of our products, but also give you then the protocols of why to implement them into your practice, to your clients and your patients. All right, so Jacqueline, where did, oh, there it is, sorry. All right, so we have for the winners, Linda Williamson, Marla Hampton, and Barbara Maddox. Thank you so much for being a part of that. I'll send you your Biodop 3 GI. That'll come from my warehouse in California. I will follow up with an email with all the information and the link to the video if you want to run through the slides again, and a sign up for the dates I'm going to do January, February, and March. For those of you that want to email me or text me an order, there you have it right here. It's D Benning, B-O-E-N-N-I-N-G. We don't pronounce the O. I've been called a lot worse. D Benning at bioticsresearch.com. And my cell phone, which for any of you listening in at any time, is 602-690-9636. People text me all the time to this number with questions on protocols or products, and I'm always happy to help. You know I live, eat, and breathe this job, and utilize me as a resource. I've been with this company for 25 years. I feel very blessed to have all of you as partners in utilizing our products. So thank you very much. I'm going to have Jacqueline stop the recording, and I'll go to the chat box.